So this is a story or a case example of where the window of opportunity when it comes to treating rheumatoid arthritis makes a big difference. So there's this concept of window of opportunity when it comes to treating RA that basically means that if you can catch somebody when they're at an early stage of their disease, when it's just sort of beginning, you can prevent significant progression. You can really flatten out the condition, prevent it from progressing to more permanent damage, and really making a significant difference in terms of pain and inflammation. So in this case, this was a man in his early 20s who I first met several years ago. And at that point, my feeling was that he had mild early RA. He had pains in the hands and wrists. On his labs, he had some positive antibodies, normal inflammatory parameters, and on his ultrasound, he had some very trace effusions. So he had early RA. I recommended starting methotrexate. Saw him again about 2 months later. He hadn't really been taking the methotrexate, and again, sort of encouraged him to do that so that he could prevent this progression. And we talked about this window of opportunity concept. Cut to about 1.5 years later. Had not seen him in between. Now he was doing worse. Hands and wrists were more swollen and uncomfortable. And he had not been taking any treatment at all. He just didn't feel comfortable with that. So again, examined him, evaluated him on his ultrasound. Now we had more inflammation in the joints, more effusions, meaning fluid in the joints. He now also had power Doppler uptake in the joints. That means even more inflammation, so even higher risk for progression if we don't do anything. Didn't have any erosions at that time, but again, strongly encourage him to take the treatments that we know that could prevent that kind of progression. Again, didn't see him for about 2 years, came back again. At that point, now he had even more significant limitations. Now wasn't able to do certain activities with his hands, was even having difficulty at work. Now had some deformities in his hands from prior damage. And on his ultrasound, he had not only severely active disease, he also had significant erosions and bone damage as well. At that point, again, strongly recommended starting treatment, instructing him that, look, now it's not just methotrexate, you really need to be on a biologic. And reality is that we can put your condition into good control still, but cannot reverse all the damage that's developed over the last few years. And so an example of where window of opportunity when we initially saw him was not, unfortunately, taken advantage of, and that then led to more progressive damage and disease. And in a condition like RA or other types of autoimmune inflammatory arthritis conditions, if you can get things in that window of opportunity, you can do a dramatically better job in terms of preventing progression and controlling the disease.